Hello everyone and welcome to TLDR Addiction. Today what I'd like to talk with you about is a question that I get asked a lot, which is that is marijuana really a gateway drug? And the answer to that question is unequivocally yes, but I think the confusion, because people think there's a controversy about this, I think the confusion comes from people not understanding what gateway really means. So what gateway does not mean is that if you use marijuana, you are going to use harder drugs like cocaine or methamphetamine or heroin. What it does mean, though, is that the risk that that's going to happen to you goes up. And we know that's the case from correlations we've seen over decades, that people who use harder drugs tend to use marijuana first. In fact, for heroin, that's 92%. 92% of people who use heroin have used marijuana first. Now, why is that so high? Well, the reason for that is that when you start down the road of using substances recreationally, you never start at the very end. Like if someone was to walk up to a young person and like a friend, walk up to a young person and say, hey, I've got heroin, would you like to try it? And that person had never had any drugs before in their life, they would say, no, I do not want to do that. It would be a pretty quick decline because nobody starts with heroin. It just does not work that way. But now imagine that this is a young person who has been vaping, and maybe at some point someone brings around marijuana or a THC pod and they're thinking, well, it's 2020, it's legal here in Illinois anyway. Isn't it supposed to be medicine? Not that big of a deal. So they do it. And now they're doing that and they're getting high for fun and hanging out with people who like to get high for fun. And that means that the chances are greater that they're going to be in an environment like, say, a party, hanging with their friends, where maybe someone's got a bar of Xanax, or maybe someone's brought some cocaine, or maybe someone brings some Percocet. And the Percocet, maybe they really like because it creates that sense of euphoria, and they develop an addiction to that. And then eventually they're moving up into stronger substances, getting to heroin, but usually snorting it first because that's a lower bar to climb than injecting, and eventually getting to injecting heroin. But nobody starts there. And so if you think about it this way, if heroin or methamphetamine, these really hard drugs, are like step 5, you do not get to step 5 without first taking step 1, step 2, step 3, etc. You can't go to the end unless you start at the beginning. So literally what the idea of a gateway drug is about is that you are opening a path forward to progress into drug culture, drug subculture, and addiction. It's not determinism, but it's risk. It's risk and chances. And what we've seen over and over throughout the years is that if a young person, or anyone for that matter, doesn't start down that path at all, their chances of ever getting to the end are minute. That's TLDR Addiction for today. Thanks for joining me. I look forward to talking to you again soon.